Moving on to our next topic, cervical cancer, one of the most common cancers among women, with an annual rate of 5,70,000 women being diagnosed every year. What can we do to detect it early? There has been a lot of advances in the field of cervical cancer screening and diagnostics. Today we have Dr. Anjali Hooda to talk on the topic. Dr. Anjali Hooda is a trailblazer in the fields of wellness, longevity, and preventive healthcare. As the visionary behind Live NutriFit and the author of the highly acclaimed book Think, Eat, Live Smart, Dr. Hooda has helped countless individuals take charge of their health through science backed personalized strategies. Inspired by her vision to empower people to lead healthier lives, Dr. Hooda has dedicated herself to addressing critical health challenges. In today's session, she'll shed light on advances in cervical cancer screening and ways to prevent it. It's a very vital conversation for safeguarding women's health. So please join me in welcoming Dr. Anjali Hooda. Over to you.
Hi. Hi, thank you, Dr. Ruhi. What a wonderful introduction you have given. And for all the viewers out there, thank you for joining in today. And I think without wasting much time, we should just start the session. Yeah, let's talk about statistics now, because I think this is the one of the main biggest issue here is that its incidence is only increased over the years, cervical cancer incidence. Now, as you said, Dr. Ruhi, 660,000 new cases in 22, which is like, I think it's surpassing most of the cancers of women, and 94% of the, you know, deaths are being caused, the cervical cancer is occurring more in actually lower and middle class communities, and especially in Africa and Central America, Southeast Asia, where India is also a part of Southeast Asia. And there's so much of medical burden, there is so much of financial burden, and there's lack of knowledge, there is lack of screening, and that's why the incidence has only increased of this cancer. And I think we are not screening enough. I also have a lot of patients in my practice who come to me and I ask them, did you ever get a pap smear? And they are usually, no, we never got a pap smear. Even in the age of, let's say, somebody postmenopausal also is not getting a pap smear. People during menopause, I mean, in their 50s are not getting the pap smears. So we have to start the screening at an early age, and I will be giving the pointers on how the screening should start. And this is a very important information that as a doctor you should pass to your patient, even if the patient is not coming to you for any other thing. These some preventable screenings should be passed on to your patients as and when you see them. So you can see that so many women are getting affected, and the main cause, as we all know, is HPV virus. But not all strains will cause the cancer. Although when you tell your patient to screen for for a cervical cancer, must always stress upon the fact that they have to do HPV screening. And without HPV screening, I think just a pap smear is not going to be enough, because if we should know what strains we are looking at and what HPV positivity is coming, and then accordingly, of course, the treatments. And I'm not going to be talking about treatment today. I'll be talking about screening and prevention mainly. And as you all know, yeah, let's stay on this slide. Let's stay on the incidence. Yeah, in prevalence. So as you all know that if you can detect cervical cancer amongst many other which are preventable, which are easily and early treated cancers, can be completely eradicated from the body, is one of these, cervical cancer. And you understand that 90% of the cases are happening in lower and middle class population. Why is that? Because do they not have the screening facility, or there is lack of knowledge? So this is one thing that we have to push. And if you can see on the slide, how many, what all states, if you can see the incidence, and this is very disturbing to see actually. And you can all see that Ahmedabad urban is so high, and Tripura is the lowest there. But of course, there is data from other states is not here. But I'm sure that when we talk to Dr. Amitav, he will be giving us more statistics based on, the geographical location of India. Next slide, please. All right, so this is the most important slide of this presentation, I would say. So, women should be screened for cervical cancer 5 to 10 years, starting at the age of 30, right? So, when we see a patient who's 30, 90% of the time they don't even know they should be screened, and 90% of the time they're also sexually active. So we have to one, ask them to screen, and also guide against prevention at that point, because it's a sexually transmitted virus, HPV. And if we can talk about protection during intercourse and all that is very important at this point. And young people, there's this sometimes that they will not use protection, and we'll not go into whether it's a monogamy or not these days, but this is a very important point. And when you see a patient of 25 years old, even not even 30, 25, we start with the HPV test, and then we do it every 5 years till they are 65. If the patient is 65 and older, no screening is recommended for HPV, but I would still go for a pap smear if they have an intact uterus. So pap smear should be done every 3 years, and HPV DNA every 5 years. So the last line, the 3 years pap smear and HPV DNA every 5 years is a must be done for the patients who are coming to us. Next slide. All right. So as I said, HPV is a sexually transmitted infection. It can affect the skin, the genitals, and throat. And almost all people will be affected by it, actually. And our immune system will clear out the HPV virus most of the times. And that's when functional medicine will come into play, when I'll talk about the FM. Persistent infection is the one that will cause the problem. And I will also tell you what strains are in the next slide. What are the strains that are significant when it comes to the HPV virus? Next slide. So, unusual bleeding in between periods, after menopause, after sexual intercourse. There can be a vaginal discharge, and there can be, symptoms of persistent pain in the back. And this is, I mean, I have seen a couple of cases where there has been a persistent pain in the back and patient has not been diagnosed. And pain in the legs, pain in the pelvis has to be evaluated. And there can be weight loss like any other cancer. There can be fatigue, loss of appetite. Vaginal discomfort, especially during intercourse, is one of the biggest signs, and a patient should be evaluated for dyspareunia. And there is, of course, swelling in the legs. We must, as you know, can be a very big hidden way to see some of the cancers. Next slide. All right. So, as we talk about, we will be talking a lot about vaccination, but I'm just giving a few liners here that vaccines have been developed to prevent the infection from some of the high-risk HPV types. Now, what are the high-risk HPV types? There, HPV type 31, 33, 45, 52, and 58. They are the high risk. And when you see 16 and 18, they will be low risk. But what does the vaccine prevent? We will go in detail with some of our esteemed gynecologists on that. And when should you be vaccinating? There's a lot of confusion about the vaccination. When should it be done? Can we do it after the age of 30, or should we do it for older women? So there is a lot of confusion, and this is what we aim to today clear, that this is not for everyone. This is a very age-specific vaccination. And girls and boys both should get 2 doses of HPV between the ages of 9 and 12. And teenage and young adults, 13 to 26, who have not been vaccinated or haven't got their doses, should be vaccinated as soon as possible. So a lot of like, even I talk to some of my friends and their children, they have not been vaccinated. And it's very important that we educate people about the vaccine. And recommend, and then after the age of 26 it's not recommended, and that's the discussion we'll be having in the panel. And so basically what we are trying to here say is that boys and girls both should be vaccinated between 9 and 12. That's the uh, thing that we also have to educate our patients and also educate our fellow doctors, that because all of us will see patients at some point of time of these ages, and we should be educating the parents as well as the young adults. Next slide. All right, so role of functional medicine. So I practice a lot of functional medicine, and when it comes to cervical cancer or any other cancer for that matter, functional medicine becomes a very important part of their treatment. We understand the chemo, we understand radiation, we understand all that allopathic stuff that comes with the cancers, but prevention of cancer, treatment of cancer should not be only focused on allopathy. It should also be coming to, it should be a holistic approach to treat the patient. And I'm not talking about treatment here, as I said before, but we have to understand that if the patient, let's say, has come to you with HPV of all the high risk ones, the 31, 33, 58, if you see those patients, you are, you are basically, you know that we can clear it, right? So we have to tell the patients how to get back to a better lifestyle, not drinking, not smoking, sleeping well, eating good food, losing the weight. Obesity is a very, very big risk factor for all cancers. Losing the weight and any nutritional deficiency that we see in the patient, which will come, of course. And at that point, we must, treat them. And especially if the patient is going through other modalities of treatment, we must also focus on the dietary changes that the patient should do. Antioxidant diets, which are rich in carotenoids, flavonoids, folate, because we also need a lot of methylation when it comes to detoxing your body. So giving methyl donors through food or through supplements, these are very important. And exercising, um, fasting should be encouraged in patients who have had cancers or who are at risk also, and somebody with a positive HPV. And because the body has a tremendous ability to clear HPV, that's why I'm putting so much focus on the improving the immunity of the patient, improving the gut of the patient, making sure that the patient is not um, eating junk food, and they should be educated. The education is the key to improving and preventing any disease. And basically, when we talk about antioxidant diets, so when we say okay, go on antioxidants, so it should not come in a pill. It should be focused that do the dietary changes first. Yeah. Medicine never comes in bottle. Functional medicine, Ayurvedic medicine, nothing comes in bottle.
Dr. Huda, are you there?
A lot of patients are also thinking that uh, diet means that we have to give up the gluten, we have to give up dairy. I'm not talking about giving up gluten and dairy. I'm talking about introduction of antioxidant foods in your diet, and of course, encouragement of fasting for these patients. Next slide. All right. So, role of hormone replacement therapy. Now, this is something I had to also kind of read up on a lot because I do a lot of bioidentical hormone therapy for patients. But when it comes to cervical cancer, honestly, I have not had any patient of cervical cancer to whom I have treated with HRT, because first, everybody comes with a big myth that HRT is bad. And that's the problem, that we are not able to give the full benefit of HRT to patients. And bioidentical hormone therapy can be extremely beneficial. Especially, when the cervical cancer treatment is done, the patient will have premature menopause. And when they have premature menopause, you can imagine that if they're young, they are having terrible symptoms of menopause. They're having osteoporosis, they're having low libido, they have important as quality of life. And when we are seeing these patients, do not just disregard the role of HRT. And as per many studies, if you're giving, I also was reading so much in detail today that estrogen, if we are giving estrogen HRT to patients, alone estrogen should never be given, as we all know. Anybody who's doing BHRT knows that. And there is a decreased risk of squamous cell carcinoma, but increased risk of adenocarcinoma. So how can you protect your patient? With giving the progesterone side by side, but and also, making sure that, levels are good, and you're screening patients frequently for that. Because in India, fortunately, we can screen them quite frequently, and the patient should be given the full benefit of BHRT or HRT, whatever any practitioner wants to do. But uh, I'd be very, very careful that BHRT is actually the way to go, not HRT. So anybody who is not doesn't know about BHRT can read up on that, and it's a wonderful way to increase quality of life for women, and bone health, and so many things that come with BHRT. So yeah, I would say that you have a patient of cervical cancer, whether they're getting treated or not, consider BHRT. Next slide. All right, these are the references and the sliders with the team here, and anybody who wants to play, read these articles and stuff, you can just read them. And Dr. Kanabi just mentioned on the Q&A that the chat that, yeah, it is a great way of preventing a cervical cancer also. So BHRT is one of the most important things that we can do. Thank you.